Good morning and welcome to Helen Raikes, legislative candidate from District 23. Thank you, Helen, for joining us for our virtual legislative candidate meeting this morning. My name is Gina Ragland, and with us today are lead AARP advocacy volunteers Susan DeCamp, Bob Lassen, and Danny DeLong. Emily Wick is also joining us from the AARP state office. Helen, we appreciate your taking the time to meet and discuss issues of importance to the 50-plus voter and their families in Nebraska. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Helen, if you want to start us off by giving us a little background about yourself and your campaign, and again, aiming for 5 minutes or less, that would be great. Once we've completed the opening, we'll move into the questions. So again, Thank you for joining us, and go ahead.
Thank you so much, Gina. I am really thrilled to be with you here today. I do represent District 23. I am running as a challenger to the incumbent and feel that I have a lot to offer District 23. We have many seniors in my district. I don't know how it stacks up relative to other more rural districts, but there are many. And we find them when we're walking, when we're phoning and so forth, people living alone, and they have a lot to say and their voices are super important. I live in Ashland, which is in the southeast part of our district. I live on a 100-year-old family farm. That is to say, the Raikes family's been farming in Ashland for over 100 years, and each generation has their own stamp on their approaches to agriculture. Currently, my son, Justin Raikes, is the proprietor for Ashland Farms, and my daughter-in-law, Lindsay, runs Wagyu Angus Raikes beef in downtown Ashland. And I know people in our district like beef, and so I'll just put that out there. I'm a retiring professor from the University of Nebraska. I was a Willa Cather professor, which is something I'm excited and proud of. My area has been child, youth, and family studies. So I'm a person who really champions the development of people at all stages of life. And the development of seniors is just as important to me as the development of infants and toddlers, although that has been my focus throughout my life. I am such a strong child person. I'm always advocating for children's optimal development, for children to thrive. And you're going to hear the word thriving from me throughout our interview, because that's where I put my emphasis. I've always been a person who looks for the edge, for how we can optimize outcomes or leverage the best outcomes with the resources that we have. And I'm such a devotee of the opportunities that exist within development, maintaining brain development, beginning brain development, health, and as a fundamental, so beyond it all. So why am I running? My late husband, Ron Raikes, was in the legislature from 1998 to 2008. And I saw how he was able to be effective as an independent and worked across the aisle. I think when Ron was in the legislature, the unicameral worked the way it's supposed to work, and they got a lot done. I am an independent, and I'm here for the same reasons, to try to bring people together to solve our hard problems. I feel like we have very, very challenging problems in Nebraska around taxes and schools, and deep problems that require rolling up your sleeves and forming collaborations. And I could talk more about those too if we have time to do it, but that's where I'm putting my emphasis, is on the big ticket items. Tax reform, the TIOSA formula, but all of those things do matter to seniors, I think, too. I talk to a number of seniors when I walk who are on fixed incomes, and they feel like, they can't handle their valuations going up another $20,000, because the property tax is now untenable for them. And so the property tax issue is still a big issue in our state. But I told my husband, Ron, when he died, that I would finish our service work. And I've been waiting for now 11 years to try to figure out what was I obligated to do, what was my duty. And I feel like I'm the one that got to live. I'm the one who has the health, and so I'm carrying that mantle for the both of us. But that's just where I begin. I have 4 grandchildren who live in the state of Nebraska, and I want a thriving Nebraska for our grandchildren. I want that unicameral to work the way it's supposed to work, And so, I know we can solve problems. The other thing is that rural communities have less representation in the legislature itself. I mean, we're just a minority of districts in terms of population. And yet the things that happen in rural Nebraska are driving the economy of Nebraska. So there's a leverage point for that, but I feel often that rural Nebraska gets left behind when decisions are made, and that affects our seniors mightily. Because again, they're still paying their property taxes. There's, they still care about the schools for their children, but they have to meet their own needs and so forth too. So that might be where I stop. I'm probably out of my 5 minutes for that too. You're gonna have to monitor me, Gina.
Okay. Thank you so much, Helen. That's a great introduction, and it's great to learn some more about you. We'll move into the question section now, and we provided you with a set of 3 questions pertaining to the 50 plus in Nebraska. Again, we've allotted 5 minutes approximately for each of the questions. So each of our volunteers are going to take a different question, and our first one comes from Danny DeLong, and it addresses helping people stay in their homes and communities. So
Danny, tell me where you're from. Excuse me, Gina. I'm sorry.
No.
I currently live in Beatrice. I'm a retired English teacher at Southeast Community College.
Okay.
And I formerly, my hometown in Nebraska is actually Callaway, up northwest of Kearney, about 70 miles. So I'm a Nebraska guy.
Yeah, good.
And I wanted to tell you, I just recently joined the Willa Cather Foundation.
I love that.
I know. I love all of the mailings I've got. I know the husband of the archivist over there, and so I'm kind of thrilled to be a member of the foundation and get involved a little bit, find out how it works.
Yeah, thank you for giving me that context. That's rich.
Yeah. All right, I've got a good question for you here, I think. So this will be about helping people stay in their homes and communities. And a livable community is one that is safe and secure, has housing that is affordable. In other words, no more than 30% of income is spent on housing, transportation options that allow individuals to travel by multiple means, and has supportive community features and services for people of all ages, allowing people to remain in their communities as they age. What steps will you take to ensure all Nebraskans have access to livable communities?
I just so embrace this question. It's wonderful that you gave me an example of Red Cloud, because that's a great example of, in my opinion, a thriving community. A number of things have been done by many community members, including the Yost family, who of course have passion about communities in rural Nebraska through the Nebraska Community Foundation, but members of their family do different things to facilitate the thriving. So with that, I will tell you, I did mention I had 3 pillars: property tax, keeping schools strong somehow in spite of property tax issues, and number 3, thriving rural communities. All right, I had the honor of being the keynote speaker for the Nebraska Thriving Communities Conference in 2019, in Kearney, Nebraska. And there were only over 92 communities were there represented, thinking about what does it mean for us to thrive going into the future. As I said before, I've always thought about thriving children and how we get there, especially children lacking opportunities, and how do we help families help children to thrive. But then the community is the other part of the equation, and they all work together. It's like a big ecology. And this is just as pertinent to seniors as it is to young children. And so I would take it from there. I have in this ecosystem, I have this vision that I would introduce a Thriving Communities initiative, and it wouldn't necessarily be a big funding, appropriations kind of initiative, but we would have seed money for communities, as well as funding a consultant who would be available to communities to help them web together best ideas. And the way I picture this too is that it comes up organically from the community. We have some town hall meetings. This is the kind of stuff I love too, because I love this dialogue. I think it's so important to our democracy. So it comes up through the community. The community says, what do we need to go to the next step of thriving for us? And so It could be any number of things. Affordable housing would definitely be a great example. Or it could be broadband. It's like we're stymied because we can't get reception, and that is a huge issue in many parts of rural Nebraska. Or maybe it has to do with special services for seniors. I think, we would want to hear from the seniors in those communities. But the picture I keep getting and thinking about thriving communities into the future is it's good for young families, so it attracts families into the community. So we have our school teachers and so forth, but it's also good for mature people as well. And so we would want to just hear their voices, and talk about what's possible. I think each community would counsel with its citizens. Maybe they do a survey, and the senior issues that rise to the top would be where we would start, but it could be something else. There are many opportunities out there. I mentioned the Nebraska Community Foundation, but there are other sources of funding and grants and expertise that not all of our communities embrace, or maybe they don't know about them, and so that's the low-hanging fruit almost, that's what the consultant does. It's like, hey, have you signed up for this? We could do this, and then we could apply for this grant and so forth. So that's a very specific example. Ashland, in my opinion, is a great example of senior housing. Good food, security, a social worker who relates to the residents, and a pretty much funded by HUD, as I understand. But it's an example of the type of thing you can put in place, with intelligence and moxie and a vision, I think. So those are the types of things I would do. And I would just say to have that lens of the seniors, as you're thinking about what it takes to thrive.
Great, thank you.
How are we doing, Gina, for time?
Yep.
I just have one quick comment, Helen, and AARP is right with you. One of our 3 challenge grants this year went to Hagler, the community of Hagler, way out on the Colorado border. Just a small community, and they wrote a grant to us, and we funded it. So we're with you on thriving communities.
Yeah, thank you for that, Danny. I think that you're telling me you are funding some initiatives, and using them as seed money. That's really great to know. I did not know that. That's part of the beauty of this process.
Absolutely. Thank you, Helen. And again, in the interest of time, we'll go ahead and move on. And our second question today comes from Susan DeCamp, and this addresses health, caregiving, and home and community-based care. So go ahead, Susan.
Good morning, Helen. Nice to have you with us.
Thank you.
I will just tell you, I am from Omaha, more in the Millard area. It's actually Sarpy County, so my legislative district is number 49. But I have been to the Angus Beef Store in Ashland.
Yes,
and it's lovely. It's a wonderful place. So.
They're very creative.
Okay, on to business. My question. Caregivers help older persons live independently at home by providing assistance with activities such as bathing and dressing and performing medical and nursing tasks like administering medication and wound care. But caregivers often provide these services with little or no training and oftentimes little or no pay. So with that in mind, I have a 2-part question.
Okay.
First, if elected, would you support help caregivers with things such as paid leave, respite services, telehealth, and access to education and training? And secondly, how would you protect or expand paid services and supports, as well as financial security that allows seniors to remain in their homes and communities?
Thank you for that question, Susan. I think I agree that it's really important for seniors to stay in their home as long as they want. And once again, I've encountered people in their late 90s who are living alone in their homes in our district. And so I really applaud the spirit and the health of those people that they're able to do that. I think about my mother-in-law who lived at home on the farm for many years and had a health visitor who came to see her every day for an hour or 2, who just checked in with her before she went into assisted living and then eventually a nursing home. And it was wonderful that she was able to stay there as long as possible. And this having that worker who visited the home was key to making it work. So I thought about this, and first of all, I want to say that everyone has the right to benefits and professional advancement. I'm endorsed by the AFL-CIO, and that's another important tenet there too, where we have workers who don't have these kinds of benefits, and I feel like it's just wrong. We have to provide this for all of our essential workers, and I certainly regard the workers who are supporting our seniors in their homes as essential. So how do we get there? And I think this is something that would require more study, but I do have to tell you, I've been in the early childhood field for a long time, and I think the challenges are not dissimilar. And so the Buffett Early Childhood Institute just completed a workforce study focused on staff and staffing and what needs to happen to professionalize the work that early childhood people are doing. In some instances, it's better where they're affiliated with schools and so forth. They do have benefits, but in other instances, they don't. How can we pool benefits? So they're less expensive. There's now an early childhood coalition that creates a foundation for hiring, but also for substitutes and also for benefits for health insurance and so forth to bringing the costs down. So there are things that could be done. And you might tell me you've done a workforce study. I don't know, but that if you haven't, I would say that's a good place to begin. And then we need recommendations. And now the recommendations were carried to the legislature. And there was a study then that built on that will look at the early childhood workforce over the long haul and what can the legislature do on, like a 5-year, 10-year plan. Because it's quite expensive to put all of these supports in place, but it needs to be done. It's so important.
Thank you very much.
Thank you.
Okay.
And our last and final question comes from Bob Lassen, and it will address nursing facility quality. So go ahead, Bob.
Thank you. Thank you for being on today. An estimated 6,600 Nebraskans reside in one of Nebraska's 211 nursing homes. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000. Due to a variety of factors over the past years, Nebraska has seen an increase in nursing homes having to close and residents having to relocate to other facilities. How will you ensure that Nebraska residents receiving quality education and quality nursing home care to include adequate nursing workforce, again, the education part, the training, and proper reimbursement?
Right, that's quite a question, and the statistics are riveting. And I was really appreciative of seeing those and hearing those as we think about what's coming for us in Nebraska in the future years. I think this definitely connects back to the earlier questions that we've already had, too. It's like if our communities are more livable for seniors, it's easier for them to stay in their homes longer. If we have a workforce that can support them in staying in their homes, that helps too. But then there's still the question of our nursing facilities, our nursing home facilities too, because it's part of the equation. I didn't hear about the influence of COVID, but we all know that nursing homes were particularly vulnerable in a COVID environment. And so I would be curious to have some feedback from you too about how that has exacerbated the challenges that were already there. I think like childcare workers, nursing home workers were essential workers and didn't have necessarily not that they didn't have the PPEs, the protection in that sense, because I believe that administrators were trying to be as responsible as they possibly could. But, just the infrastructure to support them, or if they needed to be away from work, who's paying them? And so the challenges are there. So sometimes they're on that long end of the long list of essential workers, and receiving some of the fewest supports and benefits. So how can we protect them. I wanted to ask you too, if there are unions at all now that operate for our workers in nursing.
And that's a good question. And there are no organized unions for healthcare workers in Nebraska.
Yeah.
And that trickles down to nursing too. There really aren't. But that's an interesting question.
Yeah, and I don't know that I necessarily would say, oh, I'm advocating for that, but I think it needs to be. I would really recommend a staffing study. And then your question too inferred that there would be staffing shortages. And again, we see that in childcare. So I wanted to ask you about that as well.
There are staffing shortages in these same rural communities, and two things happen. A lot of our education right now is more centralized in the larger urban areas, and when we move people into those areas, they tend to stay. So we don't get the return of the people coming back in. And then there's a reimbursement problem. There are more reimbursement opportunities in larger cities. So
right.
It's really a two-pronged problem, and the reimbursement and the education for those rural people.
Yes, I think I'd begin with the staffing study. And I've been in the university for a number of years, and so I always begin with the data, and so how severe the problem is, and then what can we do. So thank you for telling me that too. I think we just have to keep our focus on it, and it begins with the workforce. And there need to be motivators in small communities for people to stay employed. And I do know that our healthcare workers, like our childcare workers, are often passionately devoted to providing quality social services. But, the training is really important, and they have to have the kind of income and the benefits that supports their staying in the field. And so I would be in support of whatever we can do to buttress that. And, the more we can keep people in their homes, if that's their choice, then that's a great thing too. But then we can go all the way back to our thriving communities, and each community taking responsibility for their own seniors. It is true in Nebraska that, and in rural Nebraska and my district are great examples of this. People have these super strong family ties. And, they want to take care of grandma, they want to provide the supports, but it's also true that some people don't have those families in these communities and so forth. And so we just need to really pay attention to the issue. And of course, the quality matters as well, so the regulations and the oversight and so forth are important. Are there parts of this quality question that you would like to emphasize to me in our dialogue here?
Well, I think that probably the reimbursement issue is probably the top for most of the facilities that are closing. And Nebraska's Medicaid reimbursement, for example, is like $36 a day less than what it actually costs the facilities to keep these patients.
Yes.
And so that creates a particular burden, for the facility. And eventually, most of them are, required to make some money. And when they're operating at a loss, that's normally what drives them to closing.
Well, thank you for that fact. I would say that's extremely parallel to what happens in the early childhood field when the government subsidies are running at about 75% of what other paying customers pay. And so somehow the provider has to make that up or do without. So great. I don't know, Gina, how are we doing?
We're coming to the end of our time. So again, I appreciate your thoughts and comments, and definitely I think we have much more we can talk about and probably in a follow-up. So I appreciate the open dialogue, and I think we've both made some great notes and look forward to having that future conversation.
Right.
So again, as we're coming to the end of our meeting, I'd like to offer you the final minutes to again offer any closing thoughts or comments or messages you want to send to the constituents in your district.
Right. Thank you for that opportunity. Yes, because I know there are are many constituents in my district who qualify and who are probably members of AARP. And I want to say too that, I honor so much the people I've met already on porches as we stand talking to each other with our masks on. And I'm here to listen. I think it's true that many of our seniors may have traditionally voted Republican or traditionally voted Democrat, and it's really comfortable, I think, to fall back into your old patterns, and I respect that and honor that. I'm running as an independent, which might be a new idea for people, but I will propose to you that I am the candidate for you to vote for, because I am there to solve problems, and I have always committed myself to the quality of life of people at all stages of life. And my Thriving Communities Initiative, plus who I am as a person, will give you a representative who can actually take action on these matters. And so the other thing, if this is of relevance to you, we've never had a woman representative in our legislature from this district. So I'm thinking it's probably about time. So I'd appreciate your vote. And I do have a website, rakes2020.com. And so if you have the opportunity to access that, I think you would get more information as well.
Great. Thank you again, Helen, for taking the time to visit with us. We wish you the best with your campaign. And again, thank you for meeting with AARP Nebraska today.
Yeah, thank you. It was a great
Thanks,
pleasure.
Helen.
Bye.
Helen, thank you.
Bye. Thank you.